I think that we are moving closer, we are making progress, and that I have no question that we have the votes on the floor of the House to pass this legislation.
All right, we are continuing our healthcare roundtable. Here with me, Dr. Jeffrey Kang, Chief Medical Officer at Cigna. In Washington, we have Richard Kirsch, National Campaign Manager for Healthcare for America, and John Rother, Executive Vice President for Policy and Strategy at the AARP. And in Albuquerque, New Mexico, Doug Holtz-Eakin is a former director of the Congressional Budget Office. And Doug had raised concerns about the costs, as a lot of people have. Richard, you were telling us about the ways we can expect to cut those costs.
Right, and there are ways that the CBO scores that do have more efficient payments for Medicare, rewarding better delivery of care, not overpaying Medicare, private insurance companies under Medicare, which we do now to the tune of almost $200 billion over the next 10 years, and also things that in the long run will save money that the CBO doesn't score, like investing in preventive care and primary care and more primary care providers, which will have a system that keeps people healthy. And with the old adage, an ounce of prevention is worth a pound of cure. It's true for not all individuals, but for the society as a whole. So the other thing is, let's focus on really what matters to individuals and businesses, what they can pay for their health coverage. And this bill does a lot to make that more affordable. So
what are you expecting this legislation to add to the deficit or take away from the deficit? The CBO says it adds $239 billion over the next decade.
And that's all, that has nothing to do with health care reform as people think about it, which is to say making health care affordable for families at work and not at work. That is actually for paying doctors more under Medicare, because doctors have been complaining to the Congress they're not getting paid enough under Medicare. That's what increases the deficit. It's not health care reform in terms of how people think about it.
So this legislation, you think, is not a success?
No, I think the legislation is a success. The legislation will control health care costs, will put us on a path to a delivery system that's more efficient, and will make health care affordable for people and businesses in this country, which is what Americans are looking for.
Jeffrey, let me ask you what you think about that, because what do the doctors chip in here? What do the insurance companies chip in here? What do the drug makers chip in here? I mean, we have to obviously cut costs from all directions.
So, in fact, all the parties here have chipped in things. From an insurance industry perspective, we're very much for administrative simplification, and there's a lot of savings there. The pharmaceutical industry, I can't speak for them, but they've actually volunteered some savings, so have the hospitals and the physicians. I think what's interesting from our perspective, though, is all of those savings are coming from the current players. None of those are related to the introduction of a government plan. And so what I haven't particularly heard in the debate is, why does a government plan either help us towards universal coverage or help us around the affordability issues? The affordability issues are primarily around what doctors and hospitals do and administrative simplification.
Well, or how does it help us to improve healthcare services themselves, leaving out the insurance and cost aspects? John Rother from the AARP, I've got to ask you, I mean, aren't your constituents concerned about the quality of healthcare under a plan like this?
I think there are many opportunities to do better on quality by getting rid of a lot of waste and unnecessary services that put patients at risk. Today we have financial incentives in the system that sometimes result in too much care being provided in a way that does put patients at risk.
But don't we have top quality health care if you look at the global picture? I mean, wouldn't you rather be treated for heart problems in the U.S. than, say, Eastern Europe?
Well, some places in the U.S. have top quality and some places have very poor quality. So you have to be careful about generalizing. And I would come back to the point that we have many opportunities to do better, to make the system perform better, more efficiently, less cost, both to government, to business, and individuals. And we have to do that for our future economic health, as well as getting better value for our healthcare dollar.
All right, Matt, I just want to add that the Dr. Khan's saying that the, quote, government-run plan, which is a public health insurance option, won't save money. CBO scores a public option that will only serve 10 million people. 3% of the population would save $75 billion over the next 10 years.
All right, hang on. We'll come back and we'll let the doctor answer that. Stay with us for more on this healthcare debate.